Hi, and welcome to the Leg Group podcast. The purpose of the podcast is to engage in meaningful and interesting conversations with professionals who are excelling in their field of work. We do so by initiating dialogues and having conversations about new and upcoming avenues of work, which some might even consider as unconventional. The objective of the conversation is to widen the viewers' perspectives about careers and the journeys which people take to find what they love doing. Cool, so we are live with Dr. Apurva Kulkarni with us.
Thank you for having me here.
Yes, why don't I let you introduce yourself to the viewers?
So I'm Dr. Apurva Kulkarni. I'm a sports physiotherapist. I've been working in this field for the last 7-8 years. The journey started on a very not so serious note to a very serious note now, where I have my own setup under the name Lincoln Moves. So here I've started treating a lot of national, international athletes, a lot of athletes from the Asian Games who are medalists in the Asian Games. Rutuja Bhosle, who's India number 3 tennis player but has just won a gold medal at the Asian Games 2023. Devika Vaidya, Rahul Tripathi, who were the Indian cricket team members in the Asian Games. So I've been working with them also. I'm working with Hina Sidhu, who's India's shooter. So I've been working one-on-one with her intermittently during her off tournament days and everything. Then I'm working with Shruti Mundada, who's another Indian badminton player. I was working with Neha Pandit, who is an ex-badminton player. So like this, I'm working with a lot of elite players also through various fields, and also with a lot of recreational athletes. Recreational athletes like runners, a lot of swimmers, Ironman athletes, all of them. So this is how it is. I love working in sport. And it's like a cherry on top for me to work with these elite athletes. And so this is how my journey is in sport. And now I have 3 to 4 physios working under me. And in this Lincoln Move setup, it's basically a sports science setup wherein we are providing injury prevention, injury management, recovery, where we have deep tissue massage and ice bath into it. And also some strength and conditioning aspects. So it's more of like a one-stop shop for any athlete or any active person to come and do everything what they want there.
Nice.
So this is how it is.
That's good. So, why the name Lincoln Moves?
Okay, so if you know, the body is a complete kinetic chain. What I mean by a kinetic chain is everything is interlinked. So if I have a problem in one part of my body, for example, say I have an issue with my back. So the reason can be because of a weaker hip, or the connection basically is with the hip or the upper back and so forth. So every movement also is interlinked. If you look at yourself doing any movement, there's not just one joint moving. There are a lot of joints moving together to perform that particular movement. Right. So there's a link in every movement that we do. Mm-hmm. So you can say that the movement is always linked, right. Or there's what you can say that any part is not isolated. Everything is interlinked. So the name Lincoln Moves come from there. It actually was something where I was thinking a lot about it. I did not have any clue what I would name my own setup.
Right.
So it just went on to what should I do. Now this is the day where I need to finalize what the brand name has to be. So I was just sitting down and thinking, what do I really want to talk about? What do I really want to express through my brand? And these were simple words that there is a link in movement.
Okay.
So it just turned out to be Lincoln Moves.
Nice.
Yeah.
Linked them together.
Yeah.
So from what I read and from what I know, I have realized that physiotherapy has been in the picture for centuries. And the first record of it was in the 1750s, if I'm not wrong.
Where nobody existed and we don't know anything about it.
Okay, but all right. Oh, really?
Yeah, I mean, like 1750.
15. So it said that back then there were these doctors who used to kind of practice physical manipulation, massage techniques on athletes and on workers actually. So that they obviously didn't term it and coin the term physiotherapy then, but the essence is that they were kind of practicing some kind of physical manipulation to make your muscles recover faster. but I don't know much about it. So can you briefly explain what exactly is physiotherapy and what are its benefits?
So, frankly speaking, we can't really talk about what has been there.
Okay.
But what I could say now is that the field has evolved to a very great extent. If I even look when I was born or when I was really small, nobody had this awareness about what a physiotherapist is or what do they do. They were not recognized well. Even in fact, when I was in college, that's when we were working in hospitals, but we still did not have probably a good recognition as a physiotherapist or the importance of a physiotherapist. What I see in the last decade is the field has evolved to a great extent.
Okay.
There are so many people who want to take up physiotherapy as a career also. And the importance is basically highlighted everywhere. It, I think, started more of from people watching physios running on the court in cricket matches or in tournaments. You see some doctor running up there, putting some fancy tapes, getting them assessed.
Right.
All these. So this is probably one of the ways where people started understanding it also.
Right.
And secondly, in orthopedics, I feel when even orthopedic doctors started suggesting physiotherapy post-surgery or pre-surgery to, post-surgery, especially when total knee replacement surgery grew. It's basically replacing your knees. You really have a new set of a joint, and then you have to get back on your feet, moving and doing things what you were doing previously. So this was about TKR rehabilitation that was talked about, and doctors started recommending physios to get that movement done. So physical therapists are basically ones who make you exercise and make you functionally independent, or they make you functionally better, is what I can say. So if you have an injury, that is automatically going to hamper your daily living, your daily functions.
Right.
So what physios do is they are going to work on you in a manner where they enhance that function and make you functionally so independent that you would not feel whatever glitch you had because of the injury that created a problem in your movement. So this is what physios actually started doing. So that is how they started getting recognized. I feel also there are neurophysiotherapists where they work on specific brain spinal cord condition, basically neurological conditions.
Okay.
When you might have someone undergoing a brain stroke, after which they get paralyzed, and such people, to get them back to doing specific activities that might help them in their daily functions. Then this was a part where physiotherapists came into picture and helped them do this, or guided them of how you're supposed to do it, made them rehabilitate themselves in order that they are able to do that movement with much better ease.
Oh, nice.
This is how it started coming up. So there are different fields in physiotherapy. It starts with a bachelor's for 4.5 years, where 4 years is of your education and 6 months of a compulsory internship. Okay. This is after 2 years of science after 10th. So that's 11th, 12th science, and then 4 years of bachelor's, 6 months of compulsory internship. And then it gets divided into different fields of your choice as a specialization. So there you can have sports, there you can have musculoskeletal, which means the orthopedic conditions. Then there is neurophysiotherapy, there is cardiorespiratory physiotherapy. So cardiorespiratory focuses on getting people back to what they were after, say, some heart-related surgeries or anything like respiratory disorders, and make them breathe better, all these factors. And another part was community-based or industrial-based rehabilitation, wherein we primarily work on ergonomics and with ID professionals or different community-based practices. So this is how it was divided into different fields. Now every field does have its own specialization. Every physiotherapist in that specialized field has a specialized role in every person's life. So this is how it has just evolved day after day, especially in India now, where people are also recognizing physiotherapy as a first line of practice. Which means that previously, if you must have heard that if you have an injury or if you have any sort of aches and pains, you would go to the orthopedic, get some painkillers. If he prescribes, then you would go to a physiotherapist. This was always what was practiced.
Right.
Now you can see a lot of people opting to go to a physiotherapist first and then thinking of whether I should go to the doctor or no.
Yeah.
So I have so many people coming to me. I have developed so good relations with them. So they treat me as someone who is a more trustable person, because as a physiotherapist, I feel that you spend more time with the patient, and that is very important.
It's a very personalized experience.
Correct.
Because every patient's condition also differs.
Absolutely. Right? Because it's like, for example, you go to someone and he's not going to say attend you for like, he'll look at you for like 1 or 2 minutes and then just shoo you off with, this is what you have, take these medications and go off. But a physio is someone who is going to understand you more better, because his aim is to understand your goal, is to understand what you want and not what only the treatment desires. So it's if you're going to come to me and tell me, Apurva, I have this problem. So I am going to be the person who's going to address that problem properly. Why do you have such an issue? How did you get into such an issue? And what are your goals, that I am going to be the person who's going to help you achieve them.
Right.
So this is what my job as a physiotherapist is going to be. So people start connecting to their physios better, and then slowly develop a rapport in which then they feel that whichever condition I have or whichever problem I have, I will probably ask her first or ask my physio first. If she's able to help me out and I don't want to take medicines for it, then I might as well go to her. Right. That's how it started changing, and it is changing, and it's changing for the good. Here, there is no competition between any field of medicine.
Right.
It's just everyone works together, but the importance of every specialized person or every doctor or that physio in your life is totally different when it comes to every injury or any sort of difficulty that you have.
Right.
So this is how it has started happening, which I'm glad about, because it's a very nice profession and there's so many things to do in it. And it's a great feeling when you are the one who makes the other person better.
Yeah.
So yes.
Definitely. And I believe you always have liked sports and you used to play sports. So
So I was a national roller hockey player myself. So I was into sport all the time. My parents put me in different sports to begin with. I was swimming, I was doing gymnastics, I was doing skating. Then one of my coach put me into roller hockey, made me do it. I liked it, and that's how I started pursuing it. But then it did not have a career for sure. That is something I knew of. And I had a lot of injuries. So where I got introduced to this field probably. Where I had to go to a doctor. He would tell me, 3 weeks of rest and you're done. But 3 weeks being out of the game is a big time.
Yeah.
So that hampers your performance. It just is. So that's when physios came into picture, who would try to, get someone back on the field as early as possible. So the aim was that. So that's how I started reading about it. Because I loved biology, I opted that this can be a career which will stay connected to sport also and would help me do what I like and not something which I don't like. So that's how it has become more passionate toward overall. And so my passion towards this profession is way too much, I feel.
Okay. No, makes sense. So under physiotherapy, I believe there are a lot of other kinds of treatments. As you mentioned, there's massaging, and then there is ice baths.
So I'm so glad you spoke about this, that there is massaging. Okay. This is the biggest myth what I have come across, or a misconception. You would have people talking about that physiotherapists do massage. But no, they don't. Physiotherapists are not the ones doing massage, or they're not masseuse. There are different people assigned to do a massage. And physiotherapists are more skilled people who will know the entire anatomy of the body. They would know how the movement occurs, and their aim is to get you moving. Their aim is not to just get you released and feel good and feel relaxed. Their aim is to make you functionally independent by, creating a lot of changes in your body when it comes to injuries. Say you have some amount of tightness, or you have a restriction in mobility, that is restriction in doing a particular movement. They use a few techniques which are going to just help you ease off that particular part, and going to use techniques which are going to make you move and make functionally independent. So they're not going to do massages for sure. They might have people who will help them with the massage. But yeah, this is a big myth
yeah.
that
so
people
they can
do
prescribe
have.
massages.
Definitely.
Okay.
So here at Lincoln Moves also, we do have a masseuse who helps out in getting some release done.
Okay.
So if I feel that someone's body is too tight, someone's area is too tight, and I need to get it released, because if a muscle is tight or a joint is tight, it's going to naturally create some restriction, and over a period of time, because the body is a complete kinetic chain and interconnected, if I'm going to have an issue at that place, I'm going to start developing a wrong movement pattern. I start compensating the body, and then I lead to further problems. So what a physio is going to do is basically analyze this entire movement and break it down and try to make you functionally independent also, and make your joints work or the muscles work the way they would want to. They would not be the people who would go and just keep releasing. They would want someone to release it so that they would make you move better. That's the only concept behind how masseuse and a physio would work together.
It's connected, okay.
So it's more of working together than the person doing that particular job.
So I experienced a really bad injury last year in my back, and I realized that I was stupid enough because I didn't do enough stretching. And then I went and started lifting weights, and I was destroyed. But you can get into the complex like science stuff of it also if you would like to. But what is the basic, and why is stretching so important when it comes to playing a sport? And before you engage in that sport activity, why is stretching important?
So let's break it down.
Please.
What do you mean by stretching? What do you think is stretching?
I think it is loosening up your muscles.
Okay. So stretching is primarily a technique used for improving a muscle function in terms of improving the length of the muscle. Okay. So your muscle has a desired length in which it works. If it is tighter then or non-flexible, it's not going to allow your joint to move completely. Okay. So if we have a relaxed muscle, we're going to be able to move better, and if we have good strength in the muscle, we are automatically going to move better. With stretching, what we are trying to do is we are lengthening this shortened muscle. So if my muscle is in a contracted state or in a shortened state because of my tightness, I will have to pull it out so that it is stretched and it becomes flexible enough for me to perform that particular movement. So this is what stretching is. Now you would divide a lot of components into stretching. It is going to be a dynamic stretching, it can be an active stretching, it can be a passive stretching, can be anything. What I mean by passive stretching is you would have someone do this for you. So for example, I want to stretch my hamstring. If some other third person or the physio or anyone else on the field is going to help you do that particular movement and sustain that stretch, it's a passive stretch. If it's an active stretch, it's going to be you try and use your own body to do that particular movement. For example, I'll just straighten my leg and try and bend to reach out to my knee so that I'm stretching that muscle.
Right.
And another is a dynamic kind of a stretching or a dynamic flexibility, what you would call it, where you're just like, moving to the entire range of the joint so that you're making the muscle contract and lengthen, so it loosens up to do that particular activity. So this is about stretching, and when to do that stretching is very important. So for example, if I'm going to go and do some particular activity, say I'm going to start playing a sport and I start holding a particular stretch, I'm just not going to make my muscle work efficiently. So before my game or before doing any activity, if I would want to include stretching as a warm-up strategy, I would be doing more of a dynamic flexibility or a dynamic movement wherein I'm making the joint move to the full length possible and trying to lengthen up and loosen up that muscle to make it work better. That will improve my firing of the muscle and would make me, perform better. When I would talk about something like a stretching in my warm down or a cool down session, it will be more of sustaining that stretch, making it feel better, lengthening it. But what happens?
This is cool down, post.
Yes, post the game post the exercise, post gym. You would see people stretching and then they would come and tell you that because I did not stretch, I developed a tight body. No, it's because you haven't worked your body at your full length. You haven't moved that particular joint in that full length where you start developing that rigidity or your tightness in the body.
Okay, so that stiffness happens because you haven't
moved it. For example, if I'm doing a bicep curl, okay, my entire elbow movement is this, okay.
Right.
What you would see people doing in the gym is with heavy weight, and then they would be like pumping. So you're not actually lengthening the muscle. So you're not allowing those, the components in the muscle to open up completely so that they can contract better. You're not making them do that. If you just keep on pumping and creating those shorter movements, the muscle somewhere starts and gets confused, in layman terms, start getting confused as to how it's supposed to react, and then it can sense it as an injury, and then it tries and contracts itself. So that's how it just starts developing. So instead, while doing an activity, if you keep working in the full range, you're not going to develop that amount of tightness. Then if you say, there are a lot of people who will come and say that I did not stretch after my workouts. It's fine. That is not going to improve your flexibility because you're already in a warmed up body. So if I'm going to be in a warmed up body, my muscle length is going to be anyways very good. So I will be able to do that particular movement. Right. What I would just be able to do is I would be able to extend myself better or perform a better flexibility after my workout or after my game. So, but that would be held, say, like 8 to 10 seconds and then you're done. That is going to help you in lowering down your body temperature. This will help you in a cool down strategy, but it's not going to improve flexibility. When we talk about I want to improve my flexibility or I want to be flexible enough to do try and touch my head to the knees or touch my hand to the floor, I'm talking about improving that range, improving that extensibility of the muscle. For like stretching it for minimum 30 seconds with 3 sets. So it's like I sustain that stretch for 30 seconds 3 times. That is when I would aim at improving the flexibility. This is like having an adequate dosage to do that particular movement. So if I want to aim at flexibility and I'm in the correct dosage, then definitely I would see an improvement. Or I would just say that the body is mobile enough that it would do a particular movement. And I would suggest, this is my personal opinion, stretching is something what I have always recommended to be done more in the evening when you're done with everything in the day.
Oh, okay.
So my point of view towards it is throughout the day you're working out, you're doing a lot of things, you're doing activities, and you rest out at the end of the day, right? So if I do a flexibility session just prior to me going to bed or in the evening, I tend to not work out or not do any sort of movement later. So automatically I'm actively keeping my body at rest, and with a good night's sleep I'm going to allow the muscles to recover and lengthen till the length I have already pushed it to. So then when I'm looking at next day I'm more my movement is nicer, I feel my body more recovered. This is what is my personal experience or what I have recommended people, and this is their feedback that has always been there. So there is a lot of research also coming up over it, when it should be done, how it should be done, is there any other adequate dosage for it to improve flexibility. So a lot of things. So with science, everything just keeps on changing. So if you just go to what the evidence says currently, that is going to help you move your body better.
Okay. So from what I have heard, and I might be wrong, but people also recommend doing yoga and stretches in the morning. So what's the purpose of that compared to doing it later in the day? So
yoga is another way of exercising your body. Okay, and doing yoga is not at all bad. It's a very nice form of exercise, not a problem. If someone's doing yoga, it's absolutely amazing. They are working on the mobility, they are working on the flexibility, they're trying to take their own body weight, holding it up, trying to improve some amount of tone in the muscle, which is a very good thing. So it's basically like a form of exercise. So it need not be done only in the mornings, it can be done any time throughout the day. It's like you will have some people who would prefer going to the gym in the morning. You'll have some people who would prefer finishing off the day with gym. So it's
both of them are correct?
I feel individualistic. Both of them are correct. Unless and until you're exercising, I feel you're doing the right job. So it's absolutely fine. Matter. Yes.
So given your profession, I would really want to know from you about what advice you have for people who are working from home these days, who have a sedentary lifestyle and who end up getting chronic pain in the back or the neck.
Yeah. So the age limit of what people had neck issues and back issues has reduced tremendously now because of the work from home. What I'm seeing with even, middle, say 25, 30-year-old kids also will complain of I'm having a neck pain or a back pain because of my wrong sitting postures. See, frankly, with work from home, what happened is nobody had a desk and a proper chair to sit in. Now, I wouldn't say everyone needs to have an ergonomic chair, but you need to know how you're supposed to sit. And if you technically look into how an ideal posture in sitting is, it's very difficult. For me to even sit in that posture for a long period of time is going to be very difficult. So what happens when you're aware at least what you're supposed to do, how you're supposed to maintain your sitting posture? One, it's going to help you in maintaining this. Secondly, you have to keep moving. So I wouldn't say I would be sitting in this kind of a posture for I can't sit for more than 15 minutes. It's a natural human tendency that you're going to go
relax,
slouch down and relax. That's absolutely fine. But if you just try and have some feedbacks, you can have a pillow here so that it constantly keeps on giving you a feedback that, oh no, so I'm supposed to sit straight, or I have my monitor at my eye level. That's going to help. Secondly, if I try and change my position every half an hour, I change in my position as in you can just have a small bottle, fill it up with water. You're finishing off the water and you need to go and get new water. Yeah. That's one of the ways, very simpler ways, or something that is practiced around very commonly. Or you can do a few stretches sitting in the chair itself. So you can have a few neck stretches, which is just going to help your neck move. You can, slightly just twist around, which is going to make your spine move. So you need to keep your body moving. Body is meant to move.
Yeah.
Let's make use of that. So if you're going to use it, you won't lose it, is a simple thing.
Nice. Yeah.
So if you use your body good, you're not going to lose out on, anything, that you're not going to lose out on mobility. You're not going to lose out on your flexibility. You're just going to not make yourself get into the barriers of pain.
Yeah.
So if you just keep moving, you're fine. I don't think that is going to create a problem. So people coming to me asking me how am I supposed to sit? Yes, I do teach them something, that there's a way of sitting. There is a way where you have your monitor at your eye level. If you cannot have the monitor at your eye level, your desk height is not that great enough. You can just place something under your laptop, under your monitor, so that you elevate the screen. So that is one thing that you can do. If you don't have an adjustable chair or a hydro chair, that's absolutely fine. You can just either elevate your seat some way. You can just place in pillows. You need to keep your feet relaxed. You can't keep them hanging. So you can just add up a small stool or something, a raise where you can just place your feet. So that is also going to help you maintain a relaxed posture. And you can have a small pillow at the upper back. What you would usually hear people saying is, support your lower back with some pillow or something. Okay. I wouldn't really prefer that, is because our lower back arch is already in a more exaggerated one. A lot of people will have that kind of a thing. If I keep on arching that, I'm just extending or exacerbating the curve. Instead, if I give something in the upper back, I'm automatically going to try and sit erect. I won't push it with my lower back. I would have to maintain it with my upper back, automatically making it easier for me to maintain. So this is one hack that I have experienced. Is it's easier to keep a small pillow or some support at the upper back instead of a lower back. That would automatically make you sit straight. So that's one thing. And then you just keep moving. That's it. You can, get out any reasons to move. You can have an alarm set in where it just says move.
Right.
So you just need to move. Yeah. And move is not just check your phone and you're done with it. No, move is you can just take a small walk around. Or you can just sit and stand. That's absolutely fine. You can just sit and twist in the chair. You can just move your neck to full directions. That's all you need to do. Even if you do that, you're still okay. I realize it that if you're on a call or if you're in long working hours where you're really into something, it becomes very difficult. But that's fine. Just indulge yourself in some form of exercise in your daily routine. 15-20 minutes for yourself is not a difficult task. So if you just indulge yourself in some form of exercise, that's still going to help. So it's easy. It's actually very easy. So you'll have people complaining about, I don't have time. You can't say that. You can definitely take some time for yourself. If you can't do that, what are you doing? What are you living for?
Very funny story actually. I do get up from the chair and I do stretch, but what I usually do is I go to my bed, I just lie down and then I stretch my hands everywhere.
Oh, that's still fine.
It is
There's
fine,
nothing
right?
wrong in that.
But the funny part is I was on a call and I forgot to switch off my video. And then I get up, I go to the bed and I just stretch. And then my boss asked me, what did you just do? So that was very weird. But yeah, that's a good tip actually. I'm going to try out the pillow. So upper back, from here? Like,
yeah, it's upper back is basically you'll have your shoulder blades being felt.
Right.
Bones that are sticking out just next to your spine. You can just have a small pillow and place it over here and rest it out. That's going to help. If you have an ergonomic chair which has a natural arch and supports you, then that's not a problem. If someone does not have some liberty to have such a kind of chair, these are like simple, what you would say, homemade hacks is what you can talk.
Nice. So when you get patients and when people come to you with their problems, how important is it to actually educate the person about the body and the muscle and then kind of start a treatment? And I'm talking about this through my personal experience because I faced an injury in the gym last year and I was following a workout which the trainer gave me, but which I realized wasn't really working well for me. Obviously, I didn't stretch a couple of times also, so that added to it, but I feel like that workout wasn't meant for me. Sometimes it happens. So how do you deal with patients when they...
Yeah, it is extremely important to indulge in patient education. It is extremely important that your patient is educated. Why? Is because if someone is aware of their own body, they're going to make sure they're not going to injure. Nobody likes injuring themselves.
Definitely.
So if they're educated enough of how the body is moving and how am I supposed to move or what are the modifications I need to do because I'm not able to do that particular activity, and then gradually understand and reach to my goal, it's going to be very easy for the person. It's an injury prevention kind of a technique is what we would call. So if you just realize that you also being educated, you need to know. Nobody likes that, I have no knowledge about XYZ thing and this person is telling me that's the only reason I would go and do it. No. If you start feeling it on your own, you're going to start developing more interest into it, and then you would start doing that thing with, more excitement and for a long period of time. So the compliance with if a person is educated enough, is going to be much more. So as a physiotherapist, what I've always observed, or what, a lot of my colleagues and everyone tells me, that the patient is not compliant enough to exercise. Which means that if I'm going to tell someone that you should go and do these exercises for these many number of times, this many times in the day, for these many days, he would not do it.
Right.
So he would come to you the next time and tell you that I am still facing that particular pain. So it's not the physio's fault. He has been telling you to do this. It's the patient's compliance that he's not doing it. Because either he's not understood it, or he did not develop that interest to do it, or he was not gaining any benefit out of it.
Exactly.
So that is something. But if you come to me, and I actually work a lot in patient education. So my first consultation when I'm giving someone is basically making them aware of their injury, what the injury is, how is the injury caused. And this I would know from a very detailed history. That how the pain occurred, what have you been doing this previously also, what are the activities that started hampering you, what were aggravating, what was relieving. So in this history taking session, I understand the person, that these are his weaknesses, these are his strengths of how things happened. This was a series of events that started happening. Any pre-existing injury that started causing a new injury is what I would want to know. When I connect all these dots and tell that person that this is why you have an issue, and if we start correcting all these dots, it's going to help you move better and going to make you feel better. Nobody likes living in pain. So if that is going to reduce his pain and he realizes that, then he is definitely going to be compliant enough.
Yeah.
So that's about it. So my patient education here becomes extremely important. If I educate you about your injury, about your body, about how it's going to get better if you perform this particular exercise in some other way, then you are going to realize it on your own, and the next time you do it, you're going to feel that particular movement happening in particular manner, which will make you feel compliant, and then you would do it, and then you will see a recovery, or then you'll see an improvement in your particular movement. So this is how it should be. So patient education, according to me, is the first and the most important thing what you would do when someone goes to a physio. So if he is convinced well enough and educated well enough and understands the person sitting in front of me has the knowledge and capacity to make me feel better, I'm going to be compliant enough to do that particular thing. So it's just all about that. So if this particular thing keeps on happening, if the patient is educated well enough, aware of his own body, he will not land up in injuries. He will probably prevent a lot of injuries.
Makes sense. So technically, from what I feel is that there are three reasons why people exercise. One is to feel better, one is to look a certain way, and they want to do it for a long period of time, which is endurance. So with physiotherapy, are there certain techniques which people can adopt in their everyday lives which can maybe prevent injuries in the long run?
Yeah. So, for any athlete, or injuries are a part and parcel of their life. Okay. So you can't really say that you will avoid a particular injury or prevent an injury completely.
Right.
What you will do is reduce the chances of getting injured with your own physical limitations.
Okay.
For example, if I have an issue with mobility, that is the joint range, if I have an issue with the flexibility, I am going to have an altered movement pattern happening. Okay, which means, for example, I have a hamstring tightness, or my hip mobility, my hip range is not well enough. So in a game, if I want to reach or have a bigger or longer stride suddenly to reach my shuttle, to reach my ball, and I suddenly extend it, and if my hamstring is not in a capacity to extend further, it's going to increase a chance of getting injured because it's going to get pulled.
Right.
Okay, so this is a risk factor to your injury. So if you start working on your risk factors already, if you start working on exercises which are going to help you improve mobility, if there are going to be exercises which are going to help you improve flexibility, automatically they're going to improve your function and that ability to reach there. So you will reduce the risk of getting injured by your own physical limitation. So that is a very important thing which has to be done. So injury prevention becomes more important than injury management.
Right.
And prevention is better than cure. This has been something we've been preaching since we were kids. So if we could prevent injuries also, then definitely those are going to have a much better performance. They're going to, make your career even longer. So injury prevention is very important. And that person needs to be aware, first of all. So patient education also comes in here. Why I'm restricting this movement is because I have XYZ limitations. Right. So I need to start working on these XYZ limitations to make my movement better. So that's how it should be actually.
Okay. Because one example which always comes to mind is the French Open which happened this year, where Alcaraz got his cramps while playing Djokovic. And many people said it had a lot to do with the amount of stress he was undergoing, which is why his body started cramping up. But when you're playing at that kind of a level, right, how do you make sure that you prevent certain movements?
Okay, so one is being at that level is a crazy thing.
Right.
Because the amount of mental strength you need to have to get there is humongous.
Right.
So the game is at that level is played over here.
Right.
They have been doing these activities right from their childhood. So there's no movement which is going to be at fault. Their fitness levels are bang on perfect.
Yeah.
Their nutrition is bang on perfect. Everything for them is there. So at that, when you reach at that level, the mind the anxiety levels that set in when you have a Djokovic in front of you are going to be tremendous. I would agree to people saying that, mentally it was tough for him and it did affect on the body, because the controlling organ of your entire body is the brain.
Okay.
So if your brain has all these things happening around, it is going to set in some amount of anxiety. It's going to sometimes set in a lot of cramps and everything. So if you're able to deal with your pressures there at that moment, you're set going. What injuries at that level? Do you remember Zverev getting injured for his ankle? That's a traumatic injury that happened. So these are injuries you cannot avoid on court. I would say even Alcaraz's injury, cramping, would not be only because he is not, taking care of his hydration. He's not. I'm sure there's a team of 10-15 people behind him who are doing everything they can so that he wins a Grand Slam.
Right.
But of course, at that elite level, when it's a final against Djokovic, the pressures are going to be way, way higher. So it's obviously going to be some amount of
So the mental
anxiety and
anxiety does play
yes.
a role in the physical.
So at that level, everyone works together. The psychologist has to work constantly along with him to make him feel better, to make him think better and move better. So yes, it does have a role. I would still go ahead with saying people who are saying that yes, it was his mental thing there that helped him.
Okay. So another part of this that I want to cover, another aspect that I want to talk about is recovery and rest days, and how important they actually are, not when it comes only to elite athletes, but even to people who are working out every day or doing some kind of physical exercise every day to stay in shape or for their mental health. So what is the significance and what is the importance of recovery and rest days? So
rest is actually way, way important than even exercising, I would say, if you're exercising well enough, of course. Rest is not sedentary person being better than an active person. But when you're working out, when you're exercising, when you're playing, you're creating a lot of inflammation in the body. Okay? There's a wear and tear happening in the muscles because there are a lot of stresses on the muscles, physical stresses. So there are micro tearings that happen in the muscle. There are a lot of soft tissue adaptations that are taking place. There are so many things happening in the body which we never realize. We just see that movement. But inside the body, there are thousands of things happening together. So there's a lot of inflammation that also gets created. So to settle down that inflammation, to make the muscle recover better, you need rest. Rest can be in the way of sleep. Sleep is the best recovery strategy. It can be in the form of nutrition. So after a workout, there is a certain kind of nutrition I should be having. Pre-workout or pre-game, any kind of tournament, I have a set of foods that I need to consume, which are going to help me perform better. So nutrition is one aspect. Good hydration is another aspect. Then deep tissue massage, which is going to help ease off the muscle, relax the muscle, is a recovery strategy. Ice baths are a very good recovery strategy, and it's probably even trending that you need to get into an ice bath for XYZ reasons. It's actually a very good strategy when it comes to recovery. So I would really say recovery is more important than even training a lot of times. Because with training, what happens, every day you have certain amount of loads that are being put on the body. You need to variate it, and to perform every single day with that particular intensity requires recovery. So if your body is recovered, it will be able to perform. If your body is not recovered, it's not going to be able to perform. So there you will find so many athletes getting into overuse injury. Overuse injury means that he's not had ample amount of recovery or rest in his training schedules, and he's kept on working on his body, working, where the body has gone into fatigue and has landed up in some form of injury. So that is one aspect which is also seen in a lot of athletes when their recovery load is not monitored. So load management here becomes very important. Load management is the amount of load you're putting on your body in terms of exercise or training. So the coach has his own load management techniques in aspects of training that athlete, and even the strength and conditioning coach, who is going to be the trainer for the athlete, who takes care of his fitness. he has his load management protocols. So you will not have same loads every week or every day the same amount of load. You need to alter those loads. Some days can be higher intensity days, some days can be lower intensity days, some weeks can be heavy training weeks, some weeks can be detraining weeks. So these peaks which are there, those differ on how you're managing the load, and those changes, ups and downs, are very important to keep your athlete moving for a long period of time, to keep them going for a long period of time. So in this, recovery becomes very important. Detraining can be a form of recovery. Some active recovery techniques, like I'm having a lighter session someday, can be a very good technique between the week. A lighter session in the midweek can be a good strategy where I can perform the next 2-3 days better. That can be one thing. 1 day of complete rest is extremely important for every athlete. Once a week of complete zero training and zero exercising. Because the better your body recovers, the better it is able to perform. So then they can have, so for example, if they have an off on Sunday, by their coach, by their trainer, everyone gives them an off on Sunday. Saturday post training, they can have an ice bath, or Saturday or Sunday mornings they can have such a thing, or they can have a deep tissue massage, depending on what suits the athlete better. And every athlete needs at least 8 to 10 hours of sleep, a good night's sleep. I'm not saying that 2 hours in the night, 2 hours in the afternoon, not something like that. A continuous good sound sleep for 8 to 10 hours is extremely important for every athlete to have a better performance. So the more better he recovers, the next day is always going to be better in performance. So that is why recovery or rest is extremely important. And again, the amount of protein that he's having. Because protein is something that helps in muscle recovery. Your muscle is made up of protein. So for it to repair and recover, it requires protein. So if I'm going to exercise with certain amount of load, or I'm going to practice, I'm going to cause some wear and tear in the muscle. Okay, this is a natural, it's not an injury, it's a natural wear and tear happening in the muscle. For that muscle to build up or recover, it requires amount of protein, since it's made up of protein. So if you're supplying that amount of protein, adequate amount of protein, it's going to recover better. Then you're not going to develop some amount of soreness, or your muscle is going to function better. I won't say it will avoid soreness, but definitely your muscle function is going to get better. So that is why you would need rest and recovery.
So 10 to 15 years ago, people weren't talking a lot about supplementation and nutrition. Nutrition, I'm sure they might have, but supplementation has become very popular these days, where we see many podcasters and many fitness geeks kind of promote things like creatine and all. Someone like Andrew Huberman, if you've heard of him, he promotes this a lot. So what is your take on supplementation, and in an Indian diet, how necessary is it?
So first, supplementation is not at all bad. It's definitely something that will help you or aid in your recovery process. It will aid you in your normal daily function also. So every nutrient in the body has a desired amount that needs to be there inside the body for it to function better, for it to work better. For example, say talking about protein, a normal person who is not even exercising requires at least 0.75 grams of protein per kg body weight. A recommended dosage would be 0.75 to 1 gram of protein per kg body weight. For example, if you are a 60-year-old person, you are going to require 55 to 60 grams of protein from your diet every single day to have a normal functioning. If that person is exercising or is into heavy training, his demand would be say 1 to 1.2 grams of protein, 1.5 grams of protein. If he is a bodybuilder and is having excessive loads on his muscles and has to train accordingly, is going to probably require twice the amount of protein required. So the requirement of protein depends on how heavy your workouts are, or how your activity levels are. But for a normal functioning also, here I'm saying you would require 0.75 grams to 1 gram of protein every day. Now, practically speaking, now with the lifestyle that we have, or the food sources or the nutritive sources that we have are quite lesser and would not always suffice what our body needs every single day. So the amount of food, for example, like I had told you also before, you would have your grandparents telling you that they never needed protein supplements. You would have come tell them I did not have to take tablets, or for that matter even our parents,
Right.
if you go and tell them that I'm having protein supplement and everything, they would it's my father who comes and asks me, why do you need all these things? You don't need it. And he would have a debate over it. But scientifically you do need this dietary source which is there, the dietary requirement that needs to be fulfilled. So if my general foods are not going to give you that amount of intake, that or the desired amount of protein into my body, I will require some amount of supplementation that is going to help me or aid me in my living. So the body absorbs certain amount of nutrient levels from the foods that we have. Now unfortunately the foods that we eat now are already adulterated, you can say, or don't have the amount of nutritive value it should really have. So again, from that, the absorption rate of my body also depends on how active I am. It can depend on how my metabolism is. So the absorption also per person, every body is different. Then out of all these things, how much actually is consumed by my actually say gained by my body or utilized by my body is even lesser. So the amount my body requires is not sufficed. Then obviously if I'm going to be deficient in if I'm going to be deficient in some things, or if I'm going to have that nutritive deficit in me, I will have trouble with my muscles, I will have a trouble with my body functioning well. So here supplementation plays a big role. If you help your body with some amount of external source and meet the body's demand, it's fair enough, it's okay, the body is going to be
And in
at
moderation,
ease.
there aren't any major side effects also.
Yes, so the most important thing here becomes you need to consult someone who is going to help you or guide you how much amount you need to take. So it's not like any layman's job that okay, my friend is taking this much amount of supplement, so I'll also go and take it. That doesn't work. Every body is different, every individual is different, and everybody's reaction to foods or exercise or anything is going to be different. So there is no one size fits all. So if you want to cater to your own body, take care of your own body, it's always better to go and ask the concerned person who is going to help you do these things. So supplementation, I feel, is something that every person might need at some point of life depending on how their demands are, and there's nothing wrong in taking it. So if your body needs it, just supply it.
So there's this person called Dr. Brian Paris, and he gave a TED talk, and I was listening to that, and he talks about the concept of posture being a dynamic concept, because you can't have a good posture only while sitting but then have a bad posture while standing. So he says that there's a correct posture while climbing up a staircase, while driving a car, or even while reading a book. So when posture is such a dynamic concept, how do you ensure that the posture remains correct in all these activities? And as a physiotherapist, what are some advices that you can maybe give?
So postures can be dynamic or static. Static is when you're in a same position for a long period of time and you're maintaining the same kind of posture. Dynamic posture, like he talks about, every movement that you do has a posture. So actually gait pattern, the walking pattern that you're doing, there is an ideal walking pattern. If you start working or walking in that particular manner, you are not going to face any troubles with your back or your hip or anything. So when everything and anything you do has an ideal and a non-ideal postures. So when you're in an ideal posture, you're doing any movement ideally, automatically all your muscles or your joint or your dynamics of the body, the stabilizers, the movers, all of them work together and keep you injury free, or they reduce your chances of getting injured. So like he also said, climbing a staircase has a particular posture. So if you break down that activity, what it means that to perform that particular movement, you have a set of muscle groups that are going to work to make that movement possible. If they are working well, then you will not face a problem while climbing stairs. Now, for example, I would say when you're climbing stairs, it's more of a glute dominant, which is a hip dominant movement. And when you're climbing down the stairs, it's more of a quad dominant or your front thigh muscle dominant movement. So if I want to train someone into climbing a staircase properly, I will focus more on his hip muscles than I would focus on, say, your quad muscle. But if I want to train someone who is climbing down, I would be focusing more on his eccentric control, which is going towards gravity. The muscles which are controlling your postures towards gravity, I would train them more if I want to have a movement of climbing down. So as a physiotherapist is someone who is going to know this concept. He's going to know the ideal postures of doing a particular activity, ideal postures of lifting a particular weight, ideal postures of lifting something that is there on the ground. So this is what he knows about and what he can also correct. Now, someone having a back pain, you might have heard about people saying that I'm told by my physio or my doctor to lift up by bending in the knees and then lifting up, then bending down forward. So that you can say is an ideal posture of lifting some object. So what that basically means is if you don't load a particular joint too much or stress a particular joint too much that is not designed to do that activity, then you're keeping your body in an injury free or at ease state. So if I use my entire lower body to lift a particular object, say anything that is I have to pick up from the floor, if I just bend forward and then pick it up, I have a chance of getting injured at my back. But if I use my body, I bend down, I lift it up from sideways and then I do it, the stress on my spine is going to automatically reduce, which will keep my spine at an eased position and would not predispose myself to injuries. So that is why every movement postures, if you're aware of, automatically you will be able to do them better. So again, like we spoke about before, the patient education part, if I'm able to deliver this to the patient, that this is the ideal posture to do these things, it's going to be easy for that person and help him to avoid or prevent any form of injury that is going to happen. So knowing a particular posture and working accordingly becomes very nice. There's one interesting thing I would like to tell you. If someone has an injury of the lower limb, there is an automatic change in the walking pattern that you would see. If I have a knee pain, or if you see someone, an old aged person who has an arthritic knee, he's going to walk in a more waddling fashion where he will waddle and then go forward. What he is actually doing is stressing his body even more. So that wrong movement pattern is actually the body's adaptation to try and not put much load on the knee. Okay, so then that person would walk with straightened knees and then he would start waddling and use his back muscles to put the leg forward. But what he doesn't realize that over a period of time, these back muscles, which have been extra loaded now of an activity they were not designed to do, they start hurting and then that person will land up in a back pain. So in such a case, when I talk about there is a link in every movement, this is what I would mean. That if I have a problem in my knee, I will compensate while doing a particular activity from the hip or from the back. But I don't realize that I'm putting that into more stress, which will create further trouble. So when we talk about rehabilitation also, we break it down. When we talk about managing this kind of pain, we break it down. So if my knee is hurting, I wouldn't only treat the knee. I would be treating his hip. I would be treating his ankle. I would be treating his balance. I would be treating his back. When I work on it in a more holistic manner, I'm going to be able to get the correct output I want from that particular person and put his body at ease. So in such a person, what I would start doing is I would start training his walking pattern. So relearning what you have missed out on is very important. So a person, we are never taught how to walk. The moment we start walking as a child, we just start walking. Nobody tells us to pick this leg up and then place it this way, and that is how you are going to walk better. So we tend to develop wrong patterns very easily, and body or any human being picks up wrong patterns more than what right patterns would be. So when we start developing this wrong thing, we start working the body in a wrong manner, and automatically the chain just goes on, the wrong chain goes on strengthening, and that's how injuries are predisposed. So here then we start working on the walking pattern, that you have to lift the leg up, place the heel first, then you have a foot flat, then you take the heel off, then you take the toe off. So there is a technical way of walking. And surprisingly, when we teach this to the person, his pain is automatically reduced. You understand that this was a right walking posture, this is what actually eased my knee pain, then this is how I should be walking. So like this, there is every movement that can be trained. Every movement, like he has said, has a dynamic posture, has a particular posture. If you work in that kind of a manner, it is always going to be better for your own body. So as a physiotherapist would be knowing all these things. And once he knows all these things and he's able to deliver it to that person, that patient is going to get aware of it, and then he's going to start working in that particular manner. This is how you would definitely be one of the ways where you could prevent a particular injury.
Because even as you mentioned, something as simple as walking, I was told by my running coach that when you're walking, you need to essentially keep the front part of your foot. You need to always lift your knee, which most of us don't do, including me sometimes. But how we walk is we place the heel first and then the toes. But apparently, what you're supposed to place your toes first and then
it's the midfoot that has to land.
Then.
So walking and running are two different things.
Okay.
You walk with a heel strike, you might run with a midfoot stance, because when you are having so much load on the body, when it comes to striking, if you're striking it with that intensity, automatically it's going to create a jerk up. That is why you would not want someone to land heel. But I feel running is something that can be also individualistic. Some people are comfortable running with a heel strike. Some people are comfortable running with a midfoot.
There's no right or wrong way to do it.
There is a right or wrong way.
Okay.
But sometimes you have to modify according to that person also. Your running coach is going to be the best person who is going to tell you how you're supposed to run. And then the physio helps you in, strengthening those particular areas. And so here also, in every sport also, it is a teamwork. Your physio, your coach, your strength and conditioning coach, all when they work together on a particular athlete or an individual, then your actually that team effort is going to help in improving the performance of the person. So it's a combined effort. So a dynamic or a more impactful activity is something else that we would be talking about.
So physiotherapy is not something which is only required during an injury. It can, right? I mean,
No. So it is like we have said before. Prevention is always better than cure. Physios do work a lot on injury prevention. A lot on injury prevention.
Okay.
Especially in sport. You would have a physio always working with the athlete so that he keeps performing better. He does not get into his injury phase. So working on the physical limitations, like I've mentioned before, the mobility, stability, flexibility, all these aspects, strength, balance, proprioception. When all these components are already being worked upon for a long period of time, you're reducing the chances of getting injured. So injury prevention becomes a major and a crucial aspect when it comes to any sort of sport.
Okay. So, coming back to your career and your profession with Lincoln Moves, when did you start this again?
So Lincoln Moves, I've started it surprisingly just after the first COVID wave happened. when we were allowed to resume after COVID, when we were allowed to resume clinics, that's when I started linking moves.
Okay.
And since then, it's been a journey. So I've been very fortunate enough to be a part of, as a physio for the men's and women's tennis team for the national games last year. There would be one coming up soon. So that's how it is. I was the physio of a franchisee called Chennai Lions, who was captained by Sharat Kamal.
Okay.
And there were national, international players playing TT in that team. So it was the ultimate table tennis league that happened in Balewadi. So I was a physio for that franchisee. And also that there was this movie of Shabash Mithu, which was based on Mithali Raj's life, cricketing career, which was played by Tapsi Pannu. So I got an opportunity to actually work with her as the physio during the process of her training. So she was coached and she was trained for playing cricket to be there in the movie. And of course, they needed a team so that she would, perform, keep performing, because she was practicing, she was shooting for other schedules, other movies and everything. So they also needed a physio that time, and they were shooting her in Pune. So I had the opportunity to work with her for this movie, a small part that I played there. So yeah, so that's how my professional journey has been fun also, and not just this monotonous life of being in the clinic and just working with them. So this is how it has been.
So you, being a physiotherapist, you have to be there at the event or on field, right?
Yeah, so there is on-field physiotherapy and there is going to be off-field physiotherapy.
Okay, they're two different things.
Yeah,
okay.
So on-field physiotherapy is basically something that is going to be there during the tournament or the match happening. So the physiotherapist has to be extremely attentive during the ongoing match, because he needs to see how that injury has happened, if it has happened. For example, I would tell you, if someone's running on the court or on the field, and he tends to, in a runner 3, for example, in cricket, and there you might have seen someone who's trying to reach to the stump and then he just has a catch and he falls down. If I had not seen that there, I would have not realized whether it was a injury that occurred during a contraction or that occurred during a stretch position of the leg. That makes you realize what kind of an injury is, what primary aid or the first aid has to be done at that particular movement. Because if it was a stretched injury, I wouldn't stretch that particular muscle. If it was a cramping, probably I'll go and stretch a muscle. So the first thing that the physio needs to be is very attentive throughout the match. He cannot just be like hanging around and whiling away his time. So that is a very important thing. Secondly, there is a lot of assessment that happens on court. For example, I'll tell you an incident at the National Games where we were in Ahmedabad, and the temperatures were around 40 to 42 degrees there. So, and we were playing right under the bright sun. So it was very difficult to stay hydrated, to perform at that level. Everyone was sweating a lot. There were a lot of hydration issues. So there were cramping that was happening, or there was an injury which one of our players faced, and then you get like 3 minutes. Just go there. You're like under the clock, where they're assessing that, yeah, you have 3 minutes. You need to assess, you need to treat, and that's it. In those 3 minutes, the amount of pressure that physio has, or the amount of thinking that that person needs to do, how was the injury caused, what should I be doing, how can I just strap him and get things done. So there was a lot of work in those 3 minutes, and that's all you get. So that becomes very crucial, and so the physio has to be like really perfect with his assessment, his thought process and everything. So if he's good at that, then you're saved. It's basically that way. So this is a part of on-field assessment. Or sometimes there can be seizures out there, or someone can be just hit by a ball on the head. Then your assessments related to is he going to get unconscious, the assessment just changes. So every injury on-field assessment is different, and off-field assessment is going to be different. So if you're traveling for a tournament or with a team or with an athlete, on court is going to be everything very different. Off court, once he's done with the tournament, or he's prior to the match, everything changes. So that those protocols are extremely different. So that is one thing. And when we talk about something at the clinic, that person might not be playing a tournament that time. It can be just someone who is off the tournament and just training for his upcoming tournament, or in general just training for him. So there your focus is going to be also on injury prevention. If he does not have an injury and has a match coming in say 3 weeks, my entire protocol changes. Like in the next 3 weeks, how is the intensity going to be? Then what are the deficits I'm seeing based on my assessment? Is he stuck up at the hip? Then I need to open up his hip. That kind of a thing. So this is what happens down back at the clinic. So this is how every aspect just differs. So though you have learnt it in one single go that these are the physiotherapy concept, this is the assessment and thing, when and where to apply is extremely different. And there's a big difference between what a clinical physiotherapist is and what a sports physiotherapist is. So both have a different approach in terms of getting the person back to his activity. A clinical person will be someone who will be thinking about, he has an injury, he should be, say, resting out for 2 weeks. He should be off work or off these things for XYZ days. A sports physiotherapist is someone who needs to get the athlete back on his feet as early as possible, because you have less time. You can't keep putting the athlete under rest for a long period of time. It's going to affect his career. It's going to affect his position in the team. It's going to affect his mental status, because injury is not only physical, it is also mental. If you have an injury, you have a setback. If it's a setback, it's going to start eating up your brain. That feeling of I am not able to be there to play that match. I was not a part of the selection because I was injured. So injury just creates a very negative impact, and then that's why I would say it is not just physical, it is also mental. So a physio's job there is going to be acting like a guide, acting like a friend, to listen to the issues of that athlete. Because if you are a good listener, you're going to be able to help that athlete out in a much better way. So this is how sports physios work. So sports physios are more having a more dynamic approach, a more advanced physio kind of an approach, with just the thought that we want our athletes back on the field, pit pat perfect, as early as possible. So this is how the approach also changes.
Okay. So you obviously have dealt with many sportsmen and women, and I don't know how to ask you this, but have you ever had like a tough time dealing with them? Have they been like, because not everyone is as like kind and sweetheart, like just like very open to talk to. So have you ever dealt with like a difficult athlete or somebody who is not so open?
Every person I feel is different and is difficult in some way or the other. It can be someone being very aggressive when they have lost a match. It can be someone not trusting you at all. It can be sometimes that person maybe trusts you partially. All differ. So if I don't have an athlete who's not going to trust me, I'm not going to be able to get my potential out of myself, and that athlete is not going to be happy with whatever you do. So no matter how much I know that I'm taking these things off and he's gotten better, he's not ready to accept that he's gotten better. So that's one difficult situation you're in. Or there are difficult situations when you're probably traveling with athletes, or you're dealing with athletes in the tournaments and everything. They lose a match because of any reason. Of course, losing a match is going to be tremendous amount of sadness and everything. And then whoever the person is with you, you are just going to be you're just going to unload everything out there on that person. So that is a difficult situation again to handle. You sometimes don't realize whether I should talk or no. Whether is it the right time, whether I should console that athlete, or whether I should just shut my mouth and just listen. Because sometimes that athlete just expects you to listen. He just wants to express things out. It's his way of expression. So I feel it becomes very important as a physio to know your athlete. You need to understand your athlete well. At what situations, how is he going to react? What is your role when it comes to that athlete reacting. It becomes very important. So that just you start learning the way you start understanding each other. So a very good rapport between the physio and the athlete is what keeps things better between them. So this is how we would tackle a difficult situation. Just knowing that person, giving their own space, because everyone needs it differently.
Yeah.
So you just need to understand. So yeah, when you need to cross that line, when I should talk to him or I should just listen. Sometimes they feel that the person opposite to me is just listening. So and not reacting. That can be one of the problems also that athletes face. So building a rapport just prior to all the tournament or with your athlete over a long period of time helps you in dealing with all these situations.
Nice. So as I said earlier, it's a very personalized approach to every athlete,
Yeah,
right? So
absolutely personal.
So you have to make like customized.
Yeah, so some athletes would like me talking, some athletes would like me listening. So it's just different with every person. So the rapport you build with every athlete is absolutely different. Some can be your great friends. Now, for example, Rutuja or Devika have been more of friends now than working professionals.
Yeah.
Where some athletes might just be only for my professional reason. That can be a thing. It's just also that person, how you interact with him, how you deal with him makes you that creates that closeness or creates that diversity in there.
So when it comes to something like physiotherapy, which people can use in their everyday lives, as you mentioned, prevention is better than cure. What are some nice maybe resources, articles, or like videos or content creators who people can check out?
So if you would like to really know about your body in general, Andrew Huberman is the best person I have come across to understand what a human body is, what all happens in a human body. So he is one of the things. Now, if you see the Instagram world and in general the social media, everyone's trying to be a creator. But do you really gain knowledge out of it? Is the question here. So someone having, like we have spoken about, having say 10,000 followers might not be really knowledgeable and as good as someone having 1,000 followers.
Yeah.
So it's actually your way of understanding what you need to gain out of that person. So if some person is scientifically right or logical, I would trust him more than someone just creating some content every single day and putting it up. That's my way of looking at it. So everyone's way of looking at it is going to be very different. Every person follows every person for different reasons. So like I told you, it's like a really scientific way of understanding the human body. I feel Andrew Huberman is the best person you would follow. The way he delivers the content, the scientific knowledge he has, it's probably the best I have also heard. There's one more called Eric Berg.
Eric Berg.
Yeah, okay. Who also talks about a lot of nutrition and body and the systemic changes happening in the body. He's also a nice person to listen to. Very technical again. So, and you would have a few of them who would... so, it's every person connects to every content creator very differently. Yeah. So... like I told you, if it has to be like really scientific, I would prefer just listening to these two.
Okay, nice. So there was this one page that I came across. It's called Knees Over Toes on YouTube. So this guy, what he does is he focuses only on the muscles which are below the knee up till your toes. And then he gives you activities only for those because he used to face a lot of knee issues. And he obviously doesn't want others to face it. But it's a very nice channel because you realize that there are so many muscles.
Correct.
Which go unattended until you work them out or until you stretch them. You don't even know that muscle existed.
Yeah.
That happened to me with yoga, where I was stretching my back and I realized, oh wow, I haven't felt this way in a long while. But yeah, that's a nice page, Knees Over Toes. So I think even Lincoln Moves, you share some content, right, about
Yeah, I have tried and done this.
Okay.
The consistency to just keep on producing content
that's tough.
is very tough.
Yeah,
My thought behind if I want to portray something or I want to talk something and educate someone about it is not by just showing them exercises but making them more aware. So this is what my approach is. I would want to make someone aware, and then there are thousands of people who will give you exercises. Nobody tells you how you're supposed to do that exercise. That is when a physio actually works. You are going to see a lot of pictures, a lot of videos on Instagram which talk about if you have neck pain, do these 3 exercises.
Yeah, so
These
many.
are the bullet exercises to bulletproof your neck. But is that person really competent enough to do that exercise, or is that exercise actually indicated to be done? This is not someone who comes and tells us on Instagram. That is the reason why you would go to a physiotherapist, get yourself assessed first, understand that exercise, and cater to only exercises which are specific to you. Every body is different. Every individual is unique. Everyone's reaction to particular exercises is completely different. For some, this exercise is going to be right. For some, it's not going to be right. So what is right for you and what is wrong for you needs to be understood by the person who is able to tell you that. So you need to see a person who is going to actually make you understand that exercise. This is one thing that I've followed always, and I would not prefer giving someone exercises on the phone or on the video for this very reason. Because just looking at what you're doing, I'm not going to understand. I need to feel your body. I need to feel the muscle. I need to feel that restriction in your joint for me to help you improve that.
Right.
So it can't be something seen on YouTube, seen on Instagram, that I would be telling you, do this exercise. Are you really able to do it? Is my question. If you're able to do it, go for it. If you're not able to do it, don't do it in the wrong way. This is what people end up with. They would want to do that exercise desperately, that this is going to fix my knee. I will go and do this exercise. But you have an issue with the knee. You're not going to be able to do that exercise. The person showing that exercise does not have any difficulty. He's easily going to do it. For you to do that activity, you need to correct your movement pattern first. You need to correct your pain first. And then do that exercise. The exercise is not going to be wrong. The way you're doing that exercise or the need of that exercise for you is going to be different. So this is very important. That is why an individualistic approach is required in all these things. So this is the reason why I would not keep on producing content, keep on showing exercises that need to be done. So so this is my thought behind it.
That's a very good answer actually. When someone wants to design a workout for themselves, whether it's a young adult or whether it's an adult, they need to consider their body type and how they react to exercises. So how can a physiotherapist help in such a situation, and should it become more mainstream?
So a physiotherapist knows the body. He knows everything about a movement. So how an exercise is supposed to be performed, which muscles are supposed to be recruited more in a particular exercise. So all of this is what the physio knows. So I would say that correcting someone's postures while doing an exercise, teaching them how to do a particular exercise in what particular way, what is going to be better for their body, individualistically also, is how the physio is going to help you to do. And another thing is, of course, monitoring the recovery patterns, or how they should be designing their warm-ups, how they should be designing their cool-downs. Everything is what a physiotherapy would help you. So if you are considering into getting into exercise, or if you're already exercising and you need to know your body better, or you need to know how to progress yourself or up your levels, considering the movement patterns, physio is definitely the person who will help you out. So if you're just considering to go see someone, maybe he's a better person who will help you out with this issue.
Nice. I'm gonna need that. Okay, I think we're done here. And if you want, do you have anything to share?
I just want to share that I've had a lot of fun
Nice.
doing this
Same here.
podcast. I am so glad I could share a few of my experiences. I could, converse with you on a lot of topics. So I am so happy to be here. I was excited. I am definitely getting out with an excitement also.
Nice.
So yeah, it was fun talking to you. What you're trying to promote and what you're trying to get it to the world is absolutely an amazing task.
Thank you.
So keep doing this.
Yes, the pleasure was all ours. And hope to see you soon.
Sure, definitely.
Yeah, thank you so much.
We hope you enjoy the video, and please do not forget to hit the like button and subscribe to the Leg Room channel.